So today, I'm going to talk a little bit about how the PulStar can help you and your clinic. So the PulStar is not just a great analysis and adjusting tool for the spine, but you can use it on extremities, soft tissue. We've got a special point mode that goes from 4 impulses per second and sweeps all the way up to 90 impulses per second and then back down. We also have a myofascial mode where you can keep the rate at anywhere from 50 impulses, 30 impulses per second to 50 impulses per second and be able to work along or across muscle fibers. So basically, because of the way that the PulStar works with those higher frequencies, we speak the language of the proprioceptors in the muscles themselves. So you can do a lot more than just analysis and adjusting of the spine. You can even analyze that soft tissue as well with our special compare screen. But on top of that, the system itself is a marketing tool. With the analysis information and storing the patient record, you can then email or print out that patient record to give to the patient. The email is HIPAA compliant. They can show it to their friends and family. It shows the pre-analysis, the post, everything that you adjusted, and a small description of what all that means in layman's terms so that they can explain it to friends and family. You can even tweak that message and put some information in there as well. So not only do you get analysis and adjusting the spine, treatment of soft tissue and extremities, but on top of that, marketing. And then on top of that, of course, the PulStar saves you as the doctor. 40% of clinicians get injured in the clinic in their regular manual adjusting with chiropractic. What this instrument will do is basically augment your hands. We don't replace them. We don't replace all the knowledge that you have from chiropractic college. You use that with the PulStar to not only get a more accurate analysis of what's going on with the spine, but also to ease the treatment side of things. So when you adjust, we're not manually adjusting and you using all the muscles and having to move the patient and things like that. We can analyze and treat standing, seated, or prone. So you can easily have the patient move themselves. So basically, it saves you so that you have a longer career and can keep treating patients for a longer time. We also can calculate the PVA, the patient visit average, very easily from the system if you store the patient data. That way you can track how you're doing with patient visits, keep a good close eye on exactly what's going on with those patients, and then once again use those emails to be able to market to them as well. And then on top of that, you've got a documentation system. We store the pre and post analysis, everything that was adjusted, how many times, what force level, so that can be used to augment your current documentation system as well, and be able to come back and be able to print that out and supplement the documentation that you have for those patients. So it's a tool that has many, many facets and can help your clinic in many different ways. If you're interested in the PulStar system, give us a call. We've got something new we'll be introducing pretty soon. So you'll be able to use a larger screen with a touch screen built in. So not only do you have the button on the impulse head that helps control the system, but now you can just touch the screen and be able to move through different parts of the program as well. So if you already have a PulStar and you're thinking about maybe adding something like this to the system, give us a call. We'll be able to upgrade your computer and be able to add that touchscreen to the system as well if you already have a PulStar. If not, either way, give us a call, 1-800-628-9416.